Morena, everybody. I'll just start with a karakia. Kia tūna manakitanga a te mēnaro, ki runga, te tēnā, ki tēnā o tātou, kia mahia te huia mā kihi, kia toi te kupu, toi te mana, toi te araha, toi te reo Māori, kia tuturu ka whakamaua, kia tīnā, huie tā kie. So welcome everybody. I'm Linda Cooper. I'm chair of Waitakere Health Link, and just to advise, we will be recording the presentations to post online afterwards, so people have access to your input, so they'll know who you are, and we will run the presentations in the order of the agenda. But I just want to check. I know Tracy was at a hospice get together last night with several NGOs, and some people said that they would come on today. Is there anyone here that has come on today that hadn't registered before today? No one's putting a hand up or anything. Okay, so all right, so we'll run those in the order of the agenda, but first of all, we're going to get a general update from Paula Seymour, our General Manager of Child, Women and Family Division and Site Manager for our wonderful Waitakere Hospital under the auspices of Health New Zealand Te Aotearoa. So welcome, Paula. And I know Paula is a very busy lady on site here because we're on the site too. And she's also an ex officio member of Waitakere Health Link under our constitution. So she's actually almost our last connection under the new system, because as we know, it's been tricky communicating in this new system. So we really appreciate Paula being willing to be someone who we can who gives us information about what's happening so that our community knows. So welcome, Paula, over to you.
Kia ora koutou, and lovely to see you all as usual. I think if anyone's been onto the Waitakere site recently, they would have seen quite a bit's going on in this area, and with the building works that's going out on the back of the hospital, it has impacted traffic flow, which has I know for quite a lot of people caused some headaches knowing where to go. So they have started the foundation works for our new medical ward and ICU at the back of the hospital. This has taken out some parking, and we've had to put temporary car parks in alternative locations. And they just, because of the works they're doing, they've had to stop the through road that goes around the hospital, so that will be reinstated once they've done some of these enabling works. But it's pretty exciting that it's actually happening, and we have the starts of a hole in the ground. We have also finished the facade painting at the front of the hospital, so that looks a little bit more together. And really exciting for me is that we've had some money to do finally to do wayfinding and signage across the hospital. I think it's probably one of everyone's bugbears that it is quite difficult to find your way around. There was quite a lot of work done that involved Waitakere Health Link and consumers a few years ago. There hadn't been any change since then, so we've used that to start the process. And I've got a draft design of a colour palette for the hospital, so to change it and make it and give it a bit of a refresh. So over these next few months, and this has meant a little bit of a delay to the front of housework, so it fits in with the rest of the hospital and with Manaaki Hohonu, which is our new build at the back. So we've had the same architects, and the colours have come from the Waitakere features and the Waitakere ranges, so that I think they look really lovely, and it will give the hospital a big refresh. So it's going to take some time to embed this in. We'd had some key things we had to do in advance of this work from a clinical safety point of view. So we've completed those now, and this is our next bit of work. So we've also got the birthing rooms in Piha, which are a bit ongoing. There's been a few issues found that you find with an old building when you start refurbishing it, which I'm sure many of you will know if you've done some housing refurbishments. So that's been a little bit delayed, but that's due to be finished in July, and then we'll move on to the Tehinga end. So quite a lot happening across the campus. I know parking and knowing which entrance to come in has been an issue for some people, which is why we've put some of the temporary car parks in place, but it isn't solving the problem. But I'm really, really excited that we will have a cohesive hospital with this new design palette and colour palette for the hospital. We are also hitting winter. We're using our medical day stay unit as an overflow. There's been many times over summer we could have filled our new medical ward, and with North Shore's building that you may have seen in the papers opening up at this stage, the plan is the 1st of July. There may be some movement across the hospitals while we don't have capacity, but we need to ensure that people get the best possible care. So that kind of covers the update from us. We are seeing big numbers coming in through the ED, and of course would encourage people to access primary care and community services, because you guys do the best work out there. Are there any questions about what's happening across the hospital campus?
Yeah, please just pop your hand up if you've got a question, your virtual hand up if you can. Or if not, just speak up. Nothing, I don't think, at the moment. But if people do have questions, where are we? I can't see any hand. I'm just, Samuel, please.
Thank you, Paula. Would you like to see the update on the new birthing unit within the Waitakere, the campus? So probably that will be good to for the community to know about that, which is great news, right?
So yeah, it is great news, and I understand they have that it's they've had it costed out, and it's coming up at more than they had budgeted. So there's a bit of work going on in the background to get some more money. I'm not sure exactly where that's up to. It may be with the minister's approval as it is Crown funded. So I can't give you a complete answer on that, but that's because we'd expected it to start in February this year, and it hasn't started yet. But that's the reason for it to be delayed.
Thank you. Well, I can feel a letter coming on, and I know one of our guests here, Shaz, will understand that, because she writes lots of letters, but we wrote a letter last time, and we might have to write a letter to the new minister to say, please approve that extra funding, because I know all of you, Paula, and your staff have gone through a lot to get there, and we wouldn't want it to fall at this hurdle. So we'll have to talk later. Okay, I don't see another question. So thank you very much, Paula.
Shaz, I think.
Shaz. Go, Shaz.
Yep. So Paula, I'm just wondering about mobility parking on site, and I dare say that the accessible journey from those parks to the front entrance has been looked at. I just wondered if you could just give me an update on that.
Yeah, so they did some work a few months ago on repainting the park, so they're clearly visible. Within, from what I can see, within the front main entrance, they've resurfaced some of the road, but I have to say I'm not sure if they've done that the pathway. So if you know of issues that people have had, please let me know. They've definitely, and they've put in some more mobility packs as well. So if there are issues, please let me know.
Well, I'm a full-time wheelchair user. That's so it's a very selfish question. And I do go to that particular hospital more so for visiting. And I just wondered, has somebody whose mobility is impaired, whether that's using a Zimmer frame and or a wheelchair, has somebody actually physically done that exercise? Because it would be very helpful.
Good point.
Well, what we'll do, maybe Paula, if you could just let Tracy know where we're up to, and then we can send that off to Shaz with that. Or I'm sure she'll go now and do it and feed back to us.
Yeah, that would be great.
Being a long-time disability, long-time disability advocate.
Yeah,
that's great. Thank you.
And the disability representation we've had within the district has been drawn into the national office. So sometimes we can't get that feedback as soon as we'd like. So it would be really appreciated. Any feedback like that is really appreciated.
On the site. Who? Samantha Dalwood. Yeah. Okay, we're just saying Samantha Dalwood did a lot of work on the site, but she's not here anymore. Is that right? Yeah, she's national. She's national. So that's the thing with centralising thing. We don't get that instant feedback as easily, I guess. So that would be great. Well, thank you very much. All right. Well, thank you. We'll better keep moving on, but thank you so much, Paula, yet again, and just appreciate all the work you do on this site for our community. So next we have, we've got this discussion topic called Storm Recovery Navigation Service, and we've got Lisa Sherring from Vision West, and we took up, we wanted to do this because we know that, you know, the happenings of the storms and floods at the beginning of last year really affected our community, not just in the physical space, but the mental health space. This has been huge for people. So we wanted to get somebody who's been working in this field to talk about it. So if we got Lisa here.
Hello.
Hello. So over to you, Lisa. Welcome.
Thanks very much. Kia ora, everyone. Ko Lisa Sherring tōku ingoa, and yes, I work at Vision West. I am an official provider of the Storm Recovery Navigation Service, which is delivered by the Tamaki Makaurau Recovery Office within Auckland Council. So our role basically is to provide support for Aucklanders who are affected by the storms of last year, and there were at least 6 events over the beginning of last year between January and May. So it covers that whole cohort of people. Lots of people have been impacted in lots of different ways, as you say, lots of mental health and things like that. So our role as navigators is to try and connect people to services that are available to support them. And that includes homeowners who are still having issues around their houses as well. But also a big part of our role is to reach out to try and find those who are not currently who don't know that the service and support is still available, so it's really great that I've been able to come on here with you guys, because if you know of anyone who needs support around this area, then it would be great if we can get you guys to help us reach out to people. I have got a bit of a PowerPoint which I'll attempt to share. Oh, okay, I can't share it.
We've sent it to our Mr. Tech, Ben, and he's going to share that for you.
Okay, yeah, because I just sent it. I flicked one to Tracy just now.
Yes, she just sent it to Ben.
Awesome. So yes, basically we're supporting homeowners who might have a home that was impacted by the storms. So we're supporting them around there's connections to the New Zealand Claims Resolution Service, which was set up during the Canterbury earthquakes to help people navigate that insurance process. There's funding around wellbeing where counselling sessions have been funded to support people, lots of things like that. So I'll start from the beginning. So, as I say, this Storm Recovery Navigation Service is part of the Recovery Office, which has been set up within Auckland Council. So this is a temporary office which is supporting these this kaupapa, and then the services will be brought into back into BAU Council and in all the different partner navigators as well. So this just shows the events that did happen to people. Some people were affected by the initial Auckland anniversary weekend events, and then the cyclones, and then even through to May there was events still happening. Yeah, and a lot of people, their feedback is around council keeping streams clear and things like this. So it's an ongoing effort from everyone involved. Okay, next slide. Yeah, so we're supporting anyone who is affected, and it could be tenants as well. Look, we're finding a lot of tenants are still living in houses which have not been repaired and things like that from the storms. They may have moved to other places, but they might have lost all their furniture and things like that. So we can support around that, and also again navigating through to those wellbeing services and just connecting people who might not already be connected to social services in the area around budgeting services, food supports, and things like that. So yes, this is just showing around the health and wellbeing. So this is based on what connecting people who might not already know how to connect to wellbeing services, and also that funding that's available for counselling as well. Because we're recognising that Aucklanders have been affected physically, spiritually, emotionally, financially, in lots of different ways, and 15 months on are still experiencing these issues as well. There are still a lot of people in temporary accommodation as well, which who have to find new rental properties. A lot of people whose houses aren't livable, so they're working through the process of seeing if the council can provide a buyout or mitigation options to make their homes livable again. So we can support them through that very complicated, long process. And yeah, for some, it's the financial support that's needed. So we have, for people who have lost potentially their household goods, they might be staying in temporary accommodation that's furnished. They might not have had contents insurance, so there is support around helping with home furnishings and things like that. Red Cross have been good support with that. We're getting a lot of funding through from Red Cross to support those things. And then the next slide is about privacy and consent. So obviously, like any organisation, if we are talking to people and accepting them into our systems, we are explaining that we're very conscious of the Privacy Act and making sure that we're protecting their data with, transparent practices, and that's all in our privacy policies. So we respect confidentiality and privacy rights, and so each partner navigator has their organisation privacy and consent systems, and then we're also under that Auckland Council umbrella as well. Navigators are facilitators, so we're not decision makers. We can't give advice, but we can connect individuals with the services tailored to those needs and find those experts that can help them in the different areas. And there's a lot of different areas. Could be banking, insurance, real estate agents, finding homes and things like that, property advisors, lots of different things. So participation in the Navigator service is optional, and people can opt out whenever they need. Sometimes we're just a voice on the end of the phone, sort of holding space in their journey as they're getting to their own recovery, whatever that might look like. So in our service, because of the need, we've grown every few months, and we now have 37 navigators. There's 16 that are employed directly through council, but then council also considered that their reach wasn't quite large enough, which is why they've brought on the partner navigators who are from iwi, marae and NGO across Tamaki Makaurau. So that's just a list of the partner navigators. So we've tried to make them very diverse. So there's youth organisations, there's migrant organisations, Asian services, age concern are trying to provide that wraparound support for our elderly community as well. We have different Pacifica organisations and iwi as well. And everyone's got different tools and supports that they can offer to people, along with the process that is available from all the other experts around in the community. So that's it in a nutshell. So that I don't want to go into too much detail, because basically what we're trying to do is find people who might have been affected and aren't receiving ongoing support and get them to come into our navigation service. So on the next page is there's a referral process. So if you do find someone who has been affected, we recommend them emailing navigators@aucklandcouncil.govt.nz, and this is across the whole of Tamaki Makaurau. So we have teams in the west, south, north and central. So we're covering the whole of Tamaki Makaurau. We're also doing door knocking and community events, and just as well as supporting people who are already engaged with our service. We spend a lot of our week trying to reach out to others who don't know that there's support available, and that might be because of language barriers or lack of access to internet and all the information that is available through there. On the Our Auckland site, there's a recovery page dedicated to the storm recovery, which has got a lot of frequently asked questions. There's an email, there's a newsletter that you can sign up to. There's document libraries, which has got all sorts of information. So there's a lot of information that's available for people who have been infected by the storms, which is why we want them to first come into the navigator service rather than trying to figure it out for themselves, and we can walk and journey with them to get the support, whatever that looks like, because it's completely different for each individual in each whānau. Thank you. That's the end of that. Is there any questions?
All right, I just had a question. So I guess because we're a health forum, is how much are you finding in terms of having to, because there's a lot of grief and loss around this process, even living in damp houses, sort of health issues. Are you connected up with the different health services, mental health, physical health services that may be required in this sort of holistic wraparound approach?
So yes, hopefully we are. A lot of the storm recovery navigators and the partners were community connectors as well. So we have existing links, but then we're also always looking for something else that can support people through the Family Services Directory, or for example, the Healthy Homes assessments through Noho Ahuru. Sometimes it is just us connecting with the local GP if we're concerned about someone in a particular area, to see if they're connected in that way and things like that. So potentially yes, but I mean, there's always gaps in everyone's knowledge. So maybe we don't know about all the services that are available.
Yeah. Right. So I'm just seeing if there's any other hands up. Oh, we've got Samuel there. Question.
Thank you, Lisa, for the information and presentations. Great to see that you guys are based in the West Auckland to support our community. It's great. Just to let you know, guys, and the listeners, we as Asian Network is also community connector service providers contract with the MSD. And also the Feng Fang is here from the CNSST, and they also the connector service provider. So if you have any kind of people with different cultural background and or linguistic issues, so just let us know. Then we can have a look at how we can help. Just
Great. Okay, thank you. Maybe if when this recording comes out, you could just put your details into the email that comes out after
Sure.
this. Yeah.
Great, thank
Thanks,
you.
Seymour.
I can't see any other virtual hands up. I just wondered, you're not down on the list to talk about organisation, but do you want to give us a quick overview of what Vision West does while you're here? It's a pretty broad social service, isn't it?
It is. I'll make it short. So Vision West is based in Gleneden, but we also have offices in Christchurch, Waikato, and Northwest and Westgate. We have a very big home healthcare service, and obviously you guys know how to access that through this needs assessment. On site here at Gleneden, we have budgeting services, and these are all free services. We have youth programs to support youth between 15 and 24 around training, skills update, employment. We also have some youth housing as well. Housing is a big area that we work into. We're part of the Housing First Collective, supporting people into homes. And doing that wraparound service for them as well with support navigators. We have an early childhood centre who has 30 hours free childcare between 2 and 5 years. We have our food support, so we have emergency food parcels on between Tuesday, Wednesday, and Thursday between 12 and 2. People can just come in and collect a food parcel. We also have a social supermarket on site where people can access a cheaper supermarket once a month, and then we try and also have that corridor around what their needs are and try and connect with other services as well through that link. We have a whānau centre on site which people can just walk in and have a chat with people, and we're just trying to build that rapport and meet people where they're at and find out what their current needs are. We have counselling services, and there's a range of funding available for those, ACC funding, the flood funding at the moment, and there's other funding around youth and things like that. For the flood funding in particular for our counselling services, we are holding space, so we're hoping that the wait list isn't long for people coming in who were impacted by the storms. We also have Mātanga Oranga, which is a trauma-informed Māori kaupapa-based counselling service. What else have we got?
We think we get the picture. I think you've done an enormous amount of work in West Auckland, so thank you for that, and pass our regards on to Lisa and Brooke, who lead up your organisations. I've got a couple of questions, one from Red and then one from Eileen. Red.
Yes. Kia ora, Lisa, and kia ora, everyone. Thank
Kia
you
ora,
for the
Red.
presentation. Yes. I just wanted to know a little bit more about the community connectors, navigators that you listed, and how did you get to get them, and how do they become community connectors? If you can just, yes. Thank you.
That's probably not a question for me. I think it was probably an expression of interest that came out from MSD for people to show interest in becoming navigators. So yeah, I'm not quite sure about that, the answer to that question.
Okay, well, if anyone knows, if you put it in the sidebar. Thank you, Red. So Eileen. just turn your microphone on.
Thank you, Lisa and Linda. Yeah, this is a great information for our community. But just let everyone knows that that we Asian Health Services, we have an Asian Health line. We can offer like Asian and ethnic people who do need health service information or navigation. We are happy to help them as well. If they have language barrier, we have access to our interpreting team as well. So feel free to introduce people who need further health information to call our Asian Health line. 0800 888
Can you pop it in the side? Can you pop it
I will.
in the side? That'd be really great. Thank you,
Yeah,
Eileen.
thank you very much,
coming on.
Linda.
Eileen.
Yeah.
Okay, well, thank you, Lisa. That has been really helpful, and I hope, you know, I think now with all of these organisations, they know if there's still ongoing issues and people haven't connected in to get support, that they know where to send, they know to send them to you. So thank you, that's great. So what we're going to move on to next is all of our presentations. So if anyone hadn't registered online, I think probably Eileen, you haven't, so you've had your turn, which is great, because it might have been new to you. And if we just make sure everybody's got display their name and their organisation on screen, and we're going to start with long-term conditions. So I'd ask everybody in the long-term condition list to just put their virtual hand up, and that'll come to the top of my participant list, and I'll be able to find you more easily, and you'll come to the top of the screen. That's great. And we're going to time you for 2 minutes. And if you don't pass the test, you'll be chopped off. We're pretty brutal here, just because we want to fit everybody in. So, okay, well, we're going to start with Asthma New Zealand, and that's Heather. Have you got Heather here, or anyone from Asthma New Zealand?
Yeah. Hi.
Hi, Heather. Great.
Hello.
Welcome.
Hello.
Hello.
Hi. I'm Heather from Asthma New Zealand. I'm one of the nurse educators. We provide free education and support to clients throughout New Zealand so they can live well with asthma or COPD. We accept self-referrals as well as referrals from healthcare professionals. We can provide spirometry, otherwise known as lung function testing, as well as education to healthcare professionals about asthma and COPD, and a combination of either in-person courses or courses via Zoom. Those last two, there is actually a small cost to them for those two last services. We have several education programs on offer, and I'll put a link in the chat for the services I talk about. We have the individual asthma COPD 3+ program. This consists of 3 education sessions, which are friendly and informal, and help identify gaps in the client's knowledge or treatment, and then recommend a plan which aligns with current national guidelines. During the sessions, the clients are given comprehensive demonstrations on how to use their inhalers, spacers, and emergency first aid care. We have a 3+ high school program. Once again, it's 3 visits, and it's designed to support high school students as they transition into independent management. We offer group education, so we can come and visit your school, childcare centre, nursing home, medical centre to provide asthma COPD education, which is tailored to your group's needs. And we run COPD support groups. These support groups are a friendly social service, and their aim is to relieve and reduce the isolation that can be felt by people with COPD. If you want to know more about Asthma New Zealand, just check out our website. Thank you.
Thank you very much. It's great, Heather. So we haven't got Nicola from Dementia Auckland here, but we've got Denise from Disability Connect. Welcome, Denise.
Kia ora. I've actually written something today, so I'll quickly go through it. So Disability Connect's been supporting families for over 30 years. We're what is known as a DIAS, Disability Information Advisory Service, and our vision is that people with disabilities and their families are able to live the lives they want. We support families with information, support groups, seminars, workshops, and we have a small contract for counselling for the parents of disabled children. Each year in September, we run our annual Transition Expo where we have over 100 stallholders. So if you're interested in having a stall there for what's available when people leave school from the aim at ages 14 to 25. On Friday in Massey, at Massey Community Trust, we're running a seminar working income and Waitakere Trust disability supports in the community. We have an online parent support group on a Monday night. You can check our website for the details of how to get onto that, and I'll put that in the chat. We have a Chinese support group, a called support group, and both those are monthly. We currently have a Pathfinder project in place where we get referrals from Waitakere Trust and Disability NAS and can work face-to-face with families, support them through the process of how to understand the supports they're needing and ways to access them while waiting for an assessment. And our advisors here, we're open to answering questions by email and phone calls from anyone in the community. And I'm happy to come along and talk with you at your service about how we can cooperate, work together to support the families in our community. Kia ora. We can't hear you, Linda.
I should take my own advice, unmute. Sorry, just saying we don't know if your camera lens might need cleaning because you're very Doris Day.
Yeah, I'm really sorry. I think it's
No, that's okay.
got a bit worn.
That's okay. So,
Yeah,
all
it's
right,
kind
thank
of
you.
yeah.
Never mind. Thank you very much. That's great. And please, anybody, feel free to share information in the chat bar. Now we have got Nicola from Dementia Auckland, so we'll go back to Nicola. Welcome, Nicola.
Hello, everybody. Okay, so I'm from Dementia Auckland, and I head up the Dementia Advisors and cover the West Auckland area. So we are a support service for people who are living with dementia and their whānau, carers and supporters. We have our Dementia Advisor team available to meet with families, talk through strategies, support navigation and give general emotional support. We have support groups we offer for families. I have 4 that run in the West Auckland area. We also offer education sessions by Zoom and face-to-face in person. We have one running in Henderson in July. We have a really good website, www.dementia.new Zealand. Lots of information there, including how to do a referral. Very easy orange button referrals on the top left corner for anybody. With our dementia talks, we actually have one advertised now, and it's caring for the carer, and it will be 2 hours and delivered on May the 31st. So hop online if anybody's interested in that. Kia ora, thank you very much.
Thank you. That's great. That's great to see that community education. Right. So I don't see anyone from hospice today, but they come every month. So it's okay. So we've got Richard here from Independent Living Charitable Trust. Welcome, Richard.
Hi, I'm not on the agenda because I don't think
Yes,
I'd registered. Oh, I am.
No,
Good.
you did. You did.
In that case, I'll be quick.
No, it's all right. You've got 2 minutes. It's okay.
Has it started? Am I already in it? Oh God. Just so you know, Neuroconnection, who I can't see, who normally come, I have made a link with them, done a presentation with them, and we are now going to start to do some mutual work together, which I think is the important part of what we're trying to achieve with this group. I just want to do a little bit of a shout out. We have just put a video on our Facebook page, Independent Living. I'm not much in it, so it's not great, but Tony is in it, Jackie. If you get a chance to have a look and just like it or not, that would be really helpful. I think we want to start to get more content out on video for those that would help. I went to the Hospice West event last night at Onsdorp and just wanted to have a little bit of a shout out for that. I saw some of the people who were here there. I thought that was a good event. But I'll get to the point. EGL, Enabling Good Lives. So this is me talking with my disability hat, and I know Disability Connect are also involved with DIAS. There is a community-led group trying to be created. If anybody wants any details on that, I will send that out. It's not through me. It is very early days. And their anticipation is that they're going to get right onto this, and within the next 2 years, we'll have a community-led EGL group. Yes, the next 2 years. But I can put any of those details if anyone wants. If you put the thing in the chatty thingy-majiggy, I'll send the details out. Thank you.
Thank you very much. Right, so next we have Lynn from Muscular Dystrophy Northern. Welcome, Lynn.
Thanks, Linda. Good morning, everybody. I'm here just to give you a brief overview of what we do. So we are a small non-profit incorporated society. We look after a large range of services to provide support, advocacy, and information to clients and members, families, and everybody living with muscular dystrophy. We have a huge membership, actually. I've got 809 clients throughout Auckland, which is divided into South Auckland and North Auckland. And muscular dystrophy doesn't only affect the person with the condition, it can affect the family, everybody like that. Support is vital for these people. Some of the things that we do at Muscular Dystrophy, we do home-based visits, support for new diagnosis. Sometimes it can be quite frightening for people. Referrals to appropriate agencies, advocacy and support, like visiting WINS with people, hospital appointments, anything like that. We do a lot of liaison with other services to coordinate the client's needs, give information and knowledge around their condition. Facilitate social contact. We have some support groups, we have some coffee groups. I attend some multidisciplinary clinics at Starship Hospital and Auckland Hospital just to give support to the family. We run annual family camps and we have regular newsletters and emails. We're also run or included in the Neuromuscular Registry of New Zealand, which gives information and advice on neuromuscular conditions from a more medical point of view, but also it gives people access to trials that they can participate in or look at results of trials that are held overseas, updates people on new medications that might be coming to help with their condition, and also what will and what won't be funded in the future through PharmAC. Thank you.
Very interesting. Thank you. All right. So, and as Richard said earlier, NeuroConnection aren't here, but they're in Tui Glen. We know them. And we've got Susan, and I'm sorry, I lowered your hand a bit prematurely there, Susan, in my rush to get there. So, Susan from Parkinsons.
No problem. Hi. Thank you very much for this opportunity. So I'm the Parkinson's nurse educator for all of West Auckland and all of Central Auckland. So I have just over 500 clients on my books. Parkinson's is the fastest growing neurological disorder in the world, and we are getting new referrals every day. So Parkinson's NZ is a charitable trust. Anyone can refer themselves. It's self-referral through our website. And once people are referred, they have access to me and my colleagues to do a full comprehensive assessment and any ongoing troubleshooting or support. And I'm able to refer, so I'm a really useful link between the GP and the specialist, and look more at lifestyle support and emotional and practical support. What I'm reaching out for today is I'm really wanting to get some support groups going in West Auckland because we don't have any at the moment. So I'm just wondering if we do some sharing so that we're not reinventing the wheel. So if anyone's open to that, please contact me on the chat, or my email is susan.beach@parkinsons.org.nz. So we do offer support groups, support for carers as well, and basically just to support that person on this extraordinarily challenging journey. Parkinson's is not just a dopamine deficiency, it is a total metabolic disorder. So it affects every single part of people's lives, and my job is to support them in every facet that I can. And I'd love your support as well, please, if that's possible. Thank you so much. Thank you.
Thank you, Susan. And thank you to everybody for the work they do. For most of you, it's not highly paid. It's a passion and a commitment to people to help make their lives better. Now, we've got Stroke Foundation. Emily, did you want to present?
Yes, hi everyone. I am Emily from New Zealand Stroke Foundation, and I am the community stroke advisor with the Asian focus. And as usual, our company mission is to prevent stroke and improve outcome and save life. And we receive referral a lot from hospital, but also I think everyone can refer the clients to us, even themselves. And we basically support the clients and also their family. And at the moment, my company is going through some changes. So that's it from me. Thank you.
Thank you. Thank you. And we do know, you know, Stroke Foundation is re-looking at things. So there's a little bit of uncertainty for people that work there. So we just feel for you a bit there. But now, so last in this section is Jackie from Your Way Kia Roha. Welcome, Jackie. I think you need to unmute yourself.
Sorry about that. Tēnā koutou katoa. Thank you, Linda. My name's Jackie Taylor. I'm a hearing therapist. Hearing therapists are professionally trained and qualified to support adults with hearing loss and communication difficulties. I work for a charitable trust called Way Kia Roha, formerly Life Unlimited, but it's now collaborated with a few other disability services. The hearing therapy service is a national service, so there's therapists from way up in Kaitaia right down to Invercargill. It's free for all adults 16 years and above that are New Zealand citizens or residents. And it's provided through clinics in the community. I cover the Auckland area. I have a clinic in West Auckland, 2 clinics in West Auckland, one actually on the Waitakere hospital grounds at the Waitakere Union Health Centre there. And I also have a clinic in Titirangi at Titirangi Community House. And those are run fortnightly, weekly, monthly, whatever the need. What does a hearing therapist do? We can do everything from doing a hearing assessment to see if there's a hearing loss, to helping navigate people through some funding pathways if they need some specialised equipment. We can do tinnitus management, help people to manage the impact of tinnitus. We can provide communication strategies for families, resources, equipment. We're qualified assessors for Ministry of Health funded equipment. So if you need anything to keep living the life you wish to live, we can look at getting some funding for that and helping people manage hearing aids. So it's very broad. Anyone can refer. You can ring up the 0800 number, make an appointment for yourself in whatever part of the city works for you. And as I say, it's a free service, and we don't sell anything, so you've got nothing to worry about there. Mostly we want to focus on the psychosocial impact of hearing loss, which is a hidden disability and is often very misunderstood. So we're there to support you, so please come along. So thank you very much. Tēnā koutou katoa.
Thank you, Jackie. That's great. And you're right, it is a hidden disability. And those people that say at meetings, I don't need a mic, but how do they know who can't hear? So I think if you're ever public speaking, use the mic, because you don't know who can't hear you. Thank you. So now we're on to the mental health social services area. So if you can all put your hand up virtually, that'd be great. So first of all, we've got from the Grief Centre, Katrina King. Welcome, Katrina.
Thank you. Kia ora, everyone. Lovely to be here again today. Hopefully you know, but just to summarise again, Grief Centre, we're a charitable trust, and we were established in 2009, so it is our 15th birthday this year. And we provide loss and grief support to anyone going through any form of significant loss, so children, youth, adults, families and whānau. And that loss includes not just bereavement. Everyone thinks it's generally about death, but that includes relationship loss, redundancy, illness and loss of faculty, pet loss, perinatal loss, migration, trauma, and as Lisa was talking to, loss through weather events, through losing homes after those floods. We actually did some support groups for people who had lost a lot through the weather events and floods of last year. So it is really all forms of loss that we can help with, and anyone can refer to us. We come through GP self-referral. We're here to support everyone, and we do have 4 counsellors out west in Henderson, Te Atu, Linfield and Titirangi. So we do have people on the ground offering counselling out in the west area. We also do training and professional development, and I just wanted to remind everyone that it is our conference next Friday. Let's talk about grief. We are literally almost sold out. We have 160 people coming along to talk about grief and everything around that. So we're really excited. But if you did want a last minute ticket, it's on our website, griefcentre.org.nz. Otherwise, yeah, that's us. All health professionals are welcome to that. And please, do make your clients and colleagues aware of the work that we do, because we are here to support anyone living through loss. Thank you.
Thank you, Katrina, and all the best for your conference. That sounds
Thank
pretty
you so
exciting.
much.
Right, so next we have Robin from Real World Living. Welcome, Robin.
Good morning. So I'm Robin. I work for Real World Living, and we are also a disability service. Our sites are based in Papakura and Penrose, but I've realised now we have at least 7 people that come from West Auckland to our site in Penrose. One comes from Titirangi, and the furthest is from Massey, which is a bit of a journey to Penrose, as you can imagine, each several days a week. We're only since our community day service, so we provide activities for them to participate through the day. Our Penrose site has a lot more people with a lot more complex disabilities. And they do have some able as well. In our Papakura site, we have a mixture of able, a lot of quite capable people, ACC, as well as quite disabled and needing full assistance. We have a transition service which operates the entire of Auckland, and I also work alongside all 7 transition coordinators that operate for different organisations. So I work alongside them. They work in schools when a person is leaving school and finding out the opportunities, which is why these meetings are really important as well. I'm also talking to all our families at the moment, so I need to make sure I've got all that information. So I think, just making sure that people are aware that we have a service in both of our sites, the transition services for when people are leaving school. We can do people that are ORS funded and non-ORS funded for transition. Yeah, pretty much. I think that sums me up. But my role is basically in the community, and I work across Auckland. Thank you.
Thank you, Robin. And my apologies. I skipped over Jose from Man Alive, so it's his turn now. Welcome, Jose.
Welcome. Hello, how are you, everyone? So I'm Jose from Man Alive, and we provide counseling services in the different offices that we have in Whangarei, in Orewa, in Panmure, and here in Henderson as well. So we have a group session that is called Boys Alive, that is for boys from 8 to 12 years old, is to help them to control their anger. So it's 8 sessions every Wednesday from 4 to 6:30 p.m. And at the end of the last 15 minutes, their parents join us to the group so they can know what they are learning. And that group is every school term. We have as well Boys Alive in School, and Boys Alive in School is a program that is to help kids to transitioning from year 8 to year 9, from intermediate to high school. So we have 5 sessions while they are in intermediate and 3 sessions when they are in high school. We just finished that in term 1. This is the only term that we don't have that, but in term 3, we start again that program. As well, we have a growing men counseling session that is individual sessions to help kids with anger management from 8 to 24. And the other individual session that we have is youth general counseling, that is as well from 8 to 24, to help kids with any issue that they have in any other area that is not related to anger. that usually is depression, anxiety, sexual abuse, being bullied, separation of parents, etc., etc. So you want to contact us, you can do it in our website, that is www.manalive.org.nz. Thank you so much. Have a good day, everyone.
Okay, gracias, Jose.
Gracias.
Okay, so the last in this section is Katja from Walsh Trust. Welcome, Katja.
Hi everyone, I hope you can hear me on my video.
No, she just went off. Oh, she just went off. Still there?
Hi.
Oh no,
my
here we
video,
are, you're
my
back.
camera. Can you hear me? My camera is not working, sorry.
We can hear you. You just went off for a little bit, but we can hear you again. So
Okay, good. My apologies. I didn't realize my camera on this laptop is not working. All right, well, I'll go ahead with telling you about myself. I'm Katia LaRue. I'm with Walsh Trust. The Walsh Trust stands for West Auckland. Sorry.
actually, Katja, unfortunately, it's not really good on the hearing. So we could persevere, but I think it's going to be tricky. You're kind of breaking up. Just maybe just keep going for a bit and see how we go. Otherwise, we might just have to put some. If it doesn't work, because I don't want you to be not have a chance. But if it doesn't work, just put the link and any information you want to in the chat. But keep trying for a while, and we'll see how we go.
Okay, thank you. I appreciate it. Okay, so Walsh stands for West Auckland Living Skills Home Trust. We're a charitable organisation, and our organisation has been going for over 30 years, supporting people in recovery with mental health and integrating and reintegrating into community. So services we offer include community support, Aotearoa Niwa, which is in the North Island weather events, and that is sort of the area that I'm working in, representing Walsh. Also sustaining tenancies, peer support, employment support, integrated housing and support, housing and recovery services, older person services, and maternal mental health. Also, we run health, wellness, and personal development groups. So I'll tell you a bit more about the Aotearoa Niwa service that I'm working in. So we're covering all of the Waitākere district, especially for the areas that have mostly been impacted by the floods. So we're offering a walk alongside community support service that's person-centered and flexible and designed to assist individuals and families with practical solution-focused needs, empowering them and promoting well-being for those whose lives have been affected by the floods, and not necessarily just for people who whose houses have been affected, but who have been affected in other ways, maybe just stressed out or with various experiences related to the floods.
Katja, sorry, I'm going to have to cut you off now because I've given you a lot more time, sorry, but I think that's a really good outline of what you do, and if you want to put anything in the chat, that's really great. Thank you so much.
Thank
you.
So
we're next on to the community health, and if you'd all put your virtual hands up, I'm just going to beg your indulgence. Eamon Smythe from Salvation Army Bridge has asked if he can go. He's had to come late and he's got to quickly race off. So Eamon, if you can go first, that would be good.
Yep, so just a quick overview. So I run the AOD services for Salvation Army here in Auckland. We've got 3 sites, one in Manukau, one in Mount Eden, and one in Henderson. And we run a respite service in Manurewa. We offer services which are mostly residential, but we also do day clients for people with either moderate or severe addictions. We've got multiple contracts with what were the 3 DHBs, the Te Whatu Corrections Department, and some of the old Ministry of Health contracts, as well as the Auckland Drug Courts. So we're got lots of different beds, and our occupancy is quite low. Since COVID, addiction use has gone up considerably in Auckland. There's a lot of very cheap cocaine at the moment, a lot of GHB, which is causing problems. But we're not seeing assessments and people coming in for treatment. So our services are running at about 65% occupancy. So if you've got people that are facing issues of addiction, send them through, because we've definitely got the space and the capacity to help people at this point in time. So that's the short version.
Thank you, Eamon. That's great. Good to know that, actually, because often there's not residential space for treatment, and it's good to know there's some gaps there that you can help with. All right, so next we've got Red from Aotearoa Africa Foundation. Are you there, Red? I know you were there before.
Yes.
Welcome.
I'm here. Yeah,
Right.
thank you, Linda. Good day, everyone. AAF, known as Aotearoa Africa Foundation, is a grassroots organization that works with ethnic minorities, migrant and African communities in Auckland. And the services we provide include advocacy, flood recovery, food support programs, youth support. So in terms of advocacy, we have social housing advocacy, immigration, as well as we provide free legal advice. So we try to make legal advice accessible to people in the community, especially of refugee and African background, because it's so expensive. Usually it costs $500 or $150 per consultation. So we facilitate and try to make it accessible to everyone. So with our flood recovery program, what we try to do is to connect communities that were flooded and provide the support, as well as educate for long-term recovery, and also plan in terms of like preparedness for future natural disaster. And our food support runs every Saturdays here at our AAF centers, every Saturday at 2 p.m., where we provide free food for those in need in the community. And our youth programs are usually on Thursdays with youth development, where we do a lot of activities, including thinking about leadership, health and well-being activities, and driver's license as well for young people who do not drive or will need that for future employment as well. We also help with CV workshops, and also train them with employment and jobs that they want. That's a bit of what we do in general. So we also take referral as well. So we can people can find us online on Facebook, Instagram, as well as our website as well. Thank you.
Thank you, Red. Okay, we have Fang Fang from Chinese New Settlers Services Trust. I'm skipping over because some of the people on the list aren't here, so we're just going to people are. So Fang Fang, welcome.
Thank you, Linda. Morning, everyone. My name is Fang Chen. I work for CNSST Foundation. Like Linda just mentioned, we previously known as Chinese New Settlers Services Trust. So we are the charitable trust. We provide the wraparound supporting services to the Asian New Settlers. So we have 2 offices, one in Panmure, one is in Albany. We got social services, including the social and counseling, employment and settlement. We have the education. We adult adult English classes, and then cultural learning center for the children between 5 to 17. We have a weekend class, after school, and school holiday program as well. We have the social housing. In the Pamil office, we do have the 36 social housing units, just service for the Asian seniors. We also have some translation and well-being training and immigration advisor. For health related, we actually partnership with the Aotearoa and then running our Healthy Babies, Healthy Futures program. So we do offer the 3 classes to the 3 different groups. So we got pregnancy yoga and the nutrition classes for the pregnant women and their supporting family members. We have some infant class, the new mom and support group. We're teaching the infant massage, active movement, gentle movement, sleep training, and also independent eating for the mothers and then their family members who have children under 1. We also have our toddler classes as teaching the healthy lunchbox and child nutrition and healthy eating, and then cooking demonstration as well. From 2 years ago, we also run one program is called Healthy Mother, Healthy Futures. It's just focused on the maternity, mental health, well-being. So we will regularly invite the psychologist, counselor, and social worker to talk about information regarding maternity well-being. So our classes actually run every year. So July, August, September is our online class. Then October, November, February, March, April is our in-person workshops. So referral is very easy. You can go to our website, cnsst.org.nz, and make a referral, or just give me a call, 021 760 121. I will put my number into the chat box. Thank you, Linda.
Thank you, Fun Fun. So now we have Elaine Dyer from Jade Speaks Up. Hello, Elaine.
Hi. Lovely to sit here, even though it's been very dodgy internet today. I wanted to just let you know a little tiny bit about Jade Speaks Up. It's a program that's run in schools. We train the teachers to work with 8 to 12-year-olds because we know that young children are exposed to family harm particularly. And also the teachers are telling us that post-COVID and all of the weather events that we've been having in this area, particularly, the anxiety and stress is very high among children, and the children are really struggling and the teachers are really struggling with giving them the support that they need. And so we're exploring some online trainings that teachers can do in their own time. It's quite hard to get teachers released from school during school time because of the shortage of relievers at the moment as well. And so we are running a course that will be run over 3 Thursday afternoons between 3:30 and 5. And I'll put the link in the chat again, just so that anyone who knows anyone that's either working in a class or working with young people in groups, you know, after school programs or things, might be interested in doing this training. And it's a training in interactive ways of working with children, so that children get a chance to process and learn things safely without being lectured at or told what to do. So yeah, just good to see you, and great that this network's still robust and happening, and lovely to see some familiar friends and faces here too. Yeah.
Thank you, Elaine.
Thank you.
Kia ora, Elaine. Now we've got Samuel from Tani, the Asian Network.
Thank you, Linda. Thank you, Tracy, for organizing this nice network meeting. So make us connect each other and support each other, looking for the further information for their client and our communities. This is great. So I'm Samuel Cho, a manager of Asian Network. People call us the TANI. TANI stands for the Asian Network Incorporated. So since the TANI is focused on the health promotion, and a lot of activities to increase the health awareness, in particular for the migrant and former refugee communities. So we have, but we have recently increased the capacity of the social work service This teams worked very hard for Asian community during COVID-19 times, providing a lot of information, essential support, and financial support as well. So let us know if you have any your neighbors and friends or clients from those linguistic and cultural backgrounds. So we'll have a look at what we can do. Also, we have recently established the family violence team within the social work team, focusing on the prevention. Because we trust that we can reduce a lot of the family violence related instance by raising awareness and then preventive activities. So, and also the change makers are supporting men who've been involved into the different stressful situation and the family violence as well. So as the Fang mentions, we also have the baby healthy future service providers for particular South Asian moms and babies. So I wouldn't talk about the details because Fang already mentioned about that. And we have the 5 weeks migrant women well-being programs, which is free for the migrant women and former refugee women who is vulnerable in situation settling to be more independently settled and then engage with a lot of activity in the communities. So also, which provide 5 free driving lessons on the road. Lastly, I'd like to let you know that about our regional network meetings, which is scheduled on 22nd May this month at Western Springs Garden Community Hall from 10 a.m. to 12 p.m. So apart from this service, we are always interested in the collaborative opportunity with you guys. So if you are thinking to make your service to be more inclusive for all, including those Asian communities, we are happy to discuss and to help you. Thank you.
Thank you, Samuel. So that's the end of our NGO section, but just note that Eileen from Asian Health Services from Te Whatu put her information up there, and she spoke too, which is great to see someone from Te Whatu here other than Paula. So general updates we have today are, first of all, I wanted to talk about a letter to the Minister of Health that Waitakere Health Link are going to write. We've drafted it up at the moment, but we're really talking about having that West Auckland voice in planning and decision-making for health for our community, which is what we did have before when we were partly funded by the DHB, and that is gone now. We can carry on for a while, but as I think Elaine said before and others have said, we have a network already in this forum. We have, some sort of way of connecting, but in terms of the bigger system, we're not so linked into that, and we're going to write to Minister Reti to talk about the fact that we want to be part of that locality planning as a community, as an NGO network, because that is so important for the bigger system to understand our community needs and views. And we were very privileged to have that before, but that has been somewhat lost under the new system. So we're not giving up lightly. We really want to be able to make sure our community voice is heard. And that was the purpose of Waitakere Health Link when it was set up over 20 years ago. And we want to continue that. So we are going to write a letter. It will just really talk about that. It will talk about what is the mechanism for that. We really like that. So if anybody wants to add their name to that letter, please let Tracy know. I think it's really important. This is a watershed for Waitakere, having a new minister who's looking at devolving again and having community voice. I think our community's voice needs to be heard in his planning for that. So if anybody wants to, if you want to talk to your organisation heads and you know, I'm happy to talk to anybody about that and what's in that letter, and if they want to be part of it, to share that letter with them so they know what they're signing up to. Please let us know, because I think the more organisations put their name to it, the more weight it has with the minister. So that's that. Thank you. Now, just our youth mental health and wellbeing project. Samantha, I think, talked last month about that. It's been a bit slower going, but she had Samantha is our youth representative sitting on the executive committee, and she's a West Auckland resident. She's grown up here. She's got her Bachelor of Health Sciences and postgraduate in public health from University of Auckland. She works as a youth alcohol and other drugs practitioner with rangatahi age 11 to 18 in youth justice residences. But off her own bat and as a member of the committee, she has started to work on a plan for focus groups in December after school exams with Ranui 135 and Jade Speaks Up. So any other organisation that wants to join in, please let Tracy know. She's willing to work with NGOs to develop a program. We're going to provide the community venue and catering expenses for any focus groups. And we still want to hear from you if you want to be involved. And she is happy to meet anyone in person or virtually, depending upon schedules. There's no obligation money-wise or anything like that from your side. It's just those connections and really important wisdom that you have, or connections with youth, so that we can really delve into what is going on for our youth in the mental health space. Just that intelligence that you have to help get a better picture. So if there is something that needs to be advocated for, we've got a joined up voice and approach. So we don't want to take away from anyone. We're not a service provider. We just want to be able to kind of join up all that information. We don't have to share private information, of course, but it's those general sense of what's going on, the trends, etc. Elaine, did you want to just speak to that? I see your hand up.
I just really wanted to add my endorsement to what you're saying, Linda, that, you know, I'm on a number of different forums with different government departments and non-government organisations. And one of the things that is really, really important is that they do hear from little on-the-ground organisations, because a lot of them, you know, a lot of us, including Jade Speaks Up, is really endangered at the moment, because more and more of the funding is going into big umbrella organisations. And so that if you're just a small organisation, often you don't really get your voice heard, you know, in favour for, you know, the organisations that have got lots of resources to have all of the different aspects that are covered, you know, under them. And so that they're sort of pushing more and more of our small organisations that are uniquely focused on the community needs into collaborations with big organisations where you can sometimes lose your voice as well. So, you know, just really supporting what you're saying, Linda, is that your voice counts, and I really recommend that you do join anything that is collaborative, that is putting a voice out for the importance about what we're doing connected to the community, rather than just at a strategic or political level. And so, yeah, thanks for what you're saying, Linda. Yeah.
Thank you, Elaine. So that's it for us, isn't it? I think so. What a great session. Thank you, everybody. I just first asked, was there anybody that came on that wanted to talk about their organisation, but you hadn't registered and you want that opportunity now? Please just button you're welcome. Haven't seen anybody come on, but yeah, well, first of all, I just want to thank everybody for the amazing work they do out in the community. I don't know what our community would do without organisations like you. You really do make a magnificent difference to the people in our community. And I'm looking for my karakia now. Here it is. So I'm going to say a closing karakia and wish all of you well. We'll see you next time. Good luck and well wishes with everything you do. Kia whakaere te tapu, kia wātia e te ara, kia tūru ki whakataha e, kia tūru ki whakataha e, haumi e, hui e, tā he ki e. Mā te wā.